You know, during the height of the pandemic, the government declared a health emergency that is set to expire soon. So what does that mean to you? Joining us today is Dean Cameron, president of the National Association of Insurance Commissioners, to discuss the big impact that it's going to have on health insurance. So, Dean, why is this issue so important right now?
Thanks, Michelle. Glad to be with you. So it's really important because it was set to expire tomorrow. But now it's been extended till January 11th. Just recently it was announced that it will be January 11th. Why this is important is because consumers under the public health emergency qualified for benefits and for programs that may go away January 11th. For example, they may have qualified to go on Medicaid, or they may have qualified to have extra subsidy during the public health emergency, and that may go away. And right now we're right in the start of open enrollment period, the annual open enrollment period for Medicare, annual open enrollment period for traditional health insurance. And so now's the opportunity for consumers to review their situation and plan for the future.
Good advice. What effect would the emergency ending in January have on health insurance coverage? Because that's an important piece of this.
So the biggest effect is that they may lose coverage. So you may have somebody who's on a plan right now, and January 11th it would be gone. And so it's important that they review their situation right now prior to January 11th and plan for the future.
And how can consumers protect themselves against misleading advertising around Medicare and Medicaid and ensure they're getting good coverage? Because that's so important.
Yeah, so we obviously know under Medicare there's lots of advertising going on, whether you're receiving brochures and information in the mail or television. Your favorite childhood actor or football player is advertising for you to come and buy their product. Frankly, if it sounds too good to be true, it probably is. There's no such thing as a limited time offer or special discount or come to us and we'll get your money back. Those are all issues that are designed to get you to go buy coverage from somebody out of state. Work with your local insurance agent, somebody you trust and have confidence in.
Yeah, that's such good advice. With open enrollment right around the corner, what questions should consumers ask when they're considering purchasing a health care plan?
So at annual open enrollment, it's a great time to review your plan and see if it still meets your needs. Sometimes people's prescription drugs have changed, or their doctors they're using have changed, or they've got a health condition that's changed their benefits. So the first thing is you want to look to make sure your drugs that you're taking now are covered. Secondly, that your doctor or your hospital is in network. And then you want to look at cost, not only the premium cost, but the cost of your deductible, your co-insurance, your co-pays, and measure that. Nobody wants to buy coverage and then find out that their plan's not covering enough. So you want to work with a local agent to make sure it's the appropriate product for you.
And Dean, what can consumers do if they get a surprise balance on a health care bill? That would certainly be a shock.
Yeah, so that's a good thing that Congress has recently done is they passed a new federal law on surprise balance billing. In the past, you could get a surprise balance bill if you went in under an emergency or you went into a hospital that was in network, but somehow you ended up with an out-of-network provider. Today, if I got one of those, I would go back to that provider and ask them to fix it. And if they can't get it fixed, then come to your local Department of Insurance, your state Department of Insurance. In Ohio, you've got a good commissioner there, and ask them to help you with it. Or if you don't know how to get a hold of your Department of Insurance, go to NAIC.org and you can look up the email address or phone numbers for those departments.
Okay, Dean, you've given such great information. Again, where can we go to find out more about health care plans if we're confused about maybe our options here?
So as an insurance commissioner, our job is to protect the consumer. We want to be able to be available in the event that you have any questions or concerns. Maybe you've got an issue, so go to your Ohio Department of Insurance, or if you need more information, go to NAIC.org.
Okay, Dean, thanks so much for all of this great information. Appreciate you talking with us today.
Thanks, Michelle. Happy to do it.